Good morning and welcome to Let's Talk Health and Medicare. I'm your host, Gayle Lawrence of GEL Health Advisors, and my co-host, Janet Ramirez, and our assistant, Yesenia Cervantes. We're here to give you an overview of health insurance and Medicare. In these times of the pandemic, it is more than important that we know our options on health insurance and Medicare. We will have a Q&A section and you can type in your question in the chat room or just ask your question by unmuting yourself by hitting the mute unmute button on your cell phone or pressing *6 on your phone. If you need to talk to us one-on-one, call our voice text message center at 817-381-1500. That's 817-381-1500. So let's get started. Janet, can you give us an overview of the health insurance programs that are available now?
Yes. Good morning, everyone. This morning we will be talking about healthcare. Healthcare enrollment period usually begins around November 1st. Now there is a special enrollment period, and there are a few things that may qualify you for a special enrollment period. These are a few of the things. If you have lost coverage within the next 60 days, or if you have lost coverage in the past 60 days, if you have recently gotten married, if you recently had a baby, if you have gained a dependent, if you were denied Medicaid or CHIP, or even if there was a change in your immigration status, or if you got divorced or legally separated, and that is how you lost your health coverage. And these are the things that qualify you for this special enrollment period. Now, to apply for health care, we will need the following things: your full name, social security number, date of birth, address and county, phone number, email if you have one, number of people on your tax return. That is very important. Also, your yearly adjusted gross income is one of the important things that we will need. Also, your employment name, your address, and phone number. Now, if you're self-employed, we would also need the type of job. That is something that they ask for. Now, if you don't qualify for any of these things, we have a plan that we can put you in until we're able to put you on a full plan during the enrollment period of November 1st. And you can give us a call at 817-381-1500. Again, 817-381-1500, and leave us your name and email, and we will get back to you right away as soon as possible so we can talk to you about what you qualify for. Now, for those that are turning 65 and over, Ms. Gal has some wonderful information for you this morning. Ms. Gal?
Thank you, Janet. Now, Medicare. Medicare is a federal health program. It is for people who are turning 65 years of age. However, you need to start preparing for this before you turn 65. There are different rules. For example, are you still working? Will you work doing this while you retire? We are here to walk you through the process. In addition, you may qualify for Medicare if you have been disabled for 2 years or you have certain chronic conditions or more. Timing is real important when it comes to Medicare so that you can avoid costly penalties. Now, when we start talking about Medicare, we want to go back to our childhood and we want to think about the ABCs and Ds, and there are other alphabets that take place. The A, B, C, and D. So just A plus B equals C, and then sometimes D. So we're going to look at that and we're going to go through those different parts. Now, A stands for hospital. When you were working, a lot of people will tell you that it's free. It is not free. When you or your spouse worked at least 10 years or more, you paid for Part A. It came out of your check. And A, I say, pays for anywhere that you lay your head. Hospital, hospice, nursing home, at-home care. That's what the Part A pays for. Now, the Part B, you do have a premium with that, and it varies depending on your income. The Part B pays for your doctors, the different tests you might have to have, your durable medical equipment, and things of that nature. And if you do have a premium with that, we may be able to assist you in getting some assistance in paying for that. Just give us a call. Now, Part C is not really part of Medicare, but when they started the Medicare Advantage, they call it Part C. In order to have Part C, the Medicare Advantage, you have to have Part A and Part B. You have to have both of those. And D stands for drug. Most of your Medicare Advantage plans have the drugs included, and we can give you more information on that later. Now, when you become eligible for Medicare, you have three choices. You can have Medicare, which is a private fee-for-service plan by itself, and add a drug plan so that you don't have to pay those penalties. Or you could have Medicare and a supplement. Some call it a Medigap plan. You will also need a drug plan. Now, the supplement does have a premium with it, but what the supplement does is pay the 20%. Medicare pays the 80%, and the supplement pays the 20% that you would normally have to pay. And then your third choice, you can get a Medicare Advantage plan, which we call the C plan. Medicare Advantage, and most of the time the Medicare Advantage plans, some have a premium, monthly premium, and some don't. But most include a drug plan. Again, the Medicare plus drug plan. Now, you have, when you first turn 65 or you first become eligible for Medicare, you have a time limit to get into that drug plan. If you are not in a drug plan, either from your job with credible coverage or under a Medicare plan, that the standalone drug plans, within 63 days, you will have a 1% penalty for every month that you could have been in the plan and wasn't. So timing is real important. And then with the Medicare sub, you need the drug plan also. The same timing applies. But if you get a Medicare Advantage plan that includes the drug plan, that would take care of but everything still has to be done in that 60 days. Okay, now once you get on, if you decide to go on a Medicare Advantage plan, it gives you, Medicare Advantage plan has to be just as good as a Medicare plan, but it can have additional benefits. For example, some are care coordination and disease management. We have in-home support service, wellness program, hearing, vision, dental, transportation, just a few of the extra benefits that comes along with the Medicare Advantage plan. Again, just give us a call. Now, if you qualify for Medicare and you do not have your Medicare card, you need to go to Social Security. That's ssa.gov. You would think you would go to Medicare to get that, but no, you go to Social Security, ssa.gov, because you need to have that card at least 3 months before you qualify for it. Again, if you need assistance with that, if you need someone to walk you through that, those steps, we're here to assist you. You can call us at our voice number at 817-381-1500, or you can reach us on our website, which is gelhealthadvisors.com. So that being said, do we have, at this time, do we have any questions? Yes, do we have any questions in the chat box?
No, ma'am.
Okay, since we don't have any questions, again, we would like to thank you for joining us this morning. And just for joining us this morning, we would like to send you a safety package. Since we can't deliver it in person and the office temporarily closed, Call us at our 817-381-1500 number and leave your name and mailing address, and we will get that out to you as soon as possible. We are here each Monday morning giving valuable information. And again, you can reach us on our voice text number at 817-381-1500. When you call, let us know how you heard about us. For instance, which person at GEL Health Advisor told you about this call, this event, or was it our website at GEL Health Advisors, or Facebook, a neighbor, or a friend? If there's a topic that you want more information on, just leave that topic on our voice text number and we will add it to this conversation. Thank you and have a blessed day.